Idaho Matters is brought to you in part by St. Luke's Pharmacy, now offering free home delivery. For daily medications or one time prescriptions, home delivery is easy to set up. It's convenient and safe. St. Luke's Pharmacy, now delivering to your doorstep. Information on how to get started at stlukesonline.org.
So you can't see this, but hopefully you can hear it. Behind every Boise State Public Radio podcast is a team working hard to bring you stories that matter. So if you value podcasts like this one, please support them. Hit donate at boisestatepublicradio.org. Thanks.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. Dr. Mathilde Goodrow-Simard is asking a big question. How can healthcare take better care of people without creating so much waste? She's a general internist at the Ottawa hospital, where she started noticing things like metal medical tools being used once and then thrown away. That led her to start looking for ways to make medicine more sustainable. And she's also helping reduce the use of x-rays in the ICU by using ultrasound technology instead, something that can be better for patients and better for the planet. Her work has been recognized by Choosing Wisely Canada, and tomorrow she'll be speaking at the lecture series on climate and health, which is hosted by St. Luke's Health System and Idaho Clinicians for Climate and Health. And we're lucky enough to have Dr. Simard joining us live. Dr. Simard, thanks so much for taking time for us today. We appreciate it.
Thank you so much for having me.
So you have worked with Choosing Wisely Canada. Can you tell us about who they are and what they do?
Yeah, of course. So they're an organization that works with different professional societies, like my professional society being the Canadian Society of Internal Medicine. And what they do is they really try to empower physicians to find ways to reduce unnecessary tests, treatments, and procedures for patients. Usually these tests, procedures, or treatments actually cause more harm than good. They then kind of took a turn to try to look at, if we do reduce these tests, procedures, and treatments that are unnecessary, low value, are we actually having an impact on waste and climate as well?
So I'd like to look at a couple of concrete examples of your work. I had mentioned that you had started noticing metal instruments at hospitals, that they were being used just once, then they were being thrown away. And you kind of started investigating how clinicians were using supplies. Can you talk to us a little bit about that?
Yeah, and that was actually the first project that kind of introduced me to planetary health and waste in healthcare. This was about 2 years ago. We started noticing that a lot of the tools that we were using for bedside procedures, so that's just a procedure in the patient's hospital room, were very wasteful. So when we started doing data collection, we actually realized that more than half of the tools that we bring to the bedside are completely untouched during the procedure, or actually not necessary for the procedure, and are just thrown away. So that was huge. It was more than half of the things that we brought to the bedside. And because of infection control, anything that's brought to the patient bedside has to be thrown away. So we did some work to try to reduce that, and we were able to reduce it by half, just by a few interventions on the wards.
So once you found out that they were using so many supplies, you said you were able to lower that. How did you design a plan to cut back?
Yeah, so a lot of it is about culture change and education, just making people aware of the things that they're using in clinical medicine that often is wasteful. And then we just provided our clinicians with the list of the supplies that they actually did need at the bedside for the procedure. Often you end up just, going to the utility room and grabbing everything that you can to make sure you're not missing anything, and then having to throw away a lot of that stuff. So we created this minimal supplies checklist that we put up on the wall so that people really knew exactly what they needed for the procedure, and sort of show that people were comfortable with using minimal supplies. And it started kind of a bigger discussion around our approach to supplies in the hospital, and how sometimes at home we're more conscious of the waste that we that we have, but in the hospital, we're more thinking about patients and patient care, and so trying to change that culture so that people, are less wasteful in their workplace as well, was one of the side effects, I would say, or co-benefits of this project.
Well, what's really amazing is that you managed to cut waste by 50%, and you cut the number of
Mhm.
wasted supplies from 25 to 8. However,
Right.
you did have to work really closely with doctors and nurses to really, help them understand this issue. And you really did listen to their feedback. So, is
Mhm.
that kind of cooperation important, when you are looking at making these significant types of changes?
Yeah, and I think it's really interesting that you bring that up because, this is a project that I often talk about. There's a lot of other things I've tried to do that have been unsuccessful. So, engaging early with all actors, and in a hospital, we often don't think about the thousands of people that are involved in essentially the supply chain of the hospital, be it housekeeping and nursing and respiratory therapists and pharmacists, and we work in these huge teams, and it's really a big machine. So some of the other things that we've looked at are things like reducing glove use, and that's a lot harder because there's so many people involved in using gloves, as opposed to this specific project, which was a little bit more targeted to sort of the physicians and the nurses that I have close relationships with, and that I can be a little bit more influential with, as opposed to kind of large change in this big hospital machine. And so I've done other
So,
work
here's
to do that
another.
kind of macro level stuff, but small wins are important as well in this kind of work, which tends to be difficult.
Yeah, absolutely. So I want to talk about one more example. You wanted to use fewer x-rays in the ICU
Hmm.
because you say that this is actually better for the patient and it's better for the environment. Can you talk to us about x-rays impact the planet?
Yeah, so it again, it's all about shifting the way that we think about things that we use to provide patient care. So everything that we do, whether it be tests, procedures, or treatments, have a carbon footprint, and there's actually big databases that bring together all sorts of studies from across the world that where people have done what we call carbon footprinting of different processes in medical care. And X-ray is one of them. So because of the energy that's required to run X-ray machines, obviously we don't print X-rays anymore because most of us work with electronic medical records. So at least that waste isn't generated, but there's energy required to run these machines. And when a test is inferior to another, where chest X-ray we now know is inferior to lung ultrasound, then having that alternative that's a better test and less carbon intensive, also brought to the bedside. Like the patient doesn't have to go anywhere when you do ultrasound because the physician is bringing the ultrasound to the bedside. Then it's one more reason to use that technology.
So you're suggesting that using point of care ultrasound instead of x-rays for things like, lower back pain. So can you describe this kind of ultrasound and how exactly does it work?
Yeah, so I haven't done ultrasound for lower back pain. The big ones that I've worked on is kidney ultrasound at the
Mm.
bedside as a way to reduce use of radiology ultrasound and even CT scans, and then the X-rays, like you mentioned, so using lung ultrasound instead of chest X-rays. The difficult thing about ultrasound is that there's a big learning curve. So a lot of my time in the past 5 years has been around, training people who can then train others, because it's a scope of practice, right? It's a change of practice, and I think new physicians learn it through medical school and residency training now. But my colleagues who have been in practice more than 10 years, I would say, have had very little exposure to ultrasound. And so it's all
Hmm.
about learning a new skill when you're already so busy, can be very difficult. Yeah.
So is this kind of ultrasound, would it be cheaper than an x-ray or even an
Mhm.
MRI?
Oh yeah, I mean, of course, MRIs are not only very expensive, but also very energy consuming. Ultrasound doesn't replace these really higher technologies. So MRI is very detailed, and the level of detail that you get from MRI is not one that you can get from ultrasound. It is, really what we've been able to show is that it's done in real time at the bedside. When you're seeing a patient who has difficulty breathing, you can put the probe on and rule out and rule in a lot of pathology. So, do they have a pneumonia? Well, you'll see it right away. Do they have fluid on the lungs or water on the lungs, around the lungs? You can see it right away. So, it's really been shown to be to be more rapid in terms of making the diagnosis and bringing it to the bedside, and then also has been shown to reduce other testing like X-ray. It's cheaper in the sense that we're not radiologists, so we just read it in real time as part of our patient assessments. So it's sort of part of the patient assessment when you talk about remuneration for the physician doing it.
So, what other things can clinicians and hospitals be doing to really help the health of the planet?
I mean, there's so much. There's, very high level things like using greener energies depending on where you live. That's often beyond the hospital's control. There's infrastructure changes, making your infrastructure more environmentally friendly, especially when you're building new hospitals. And then there's on the other side of the spectrum, there's small things that we can do in our daily practice. So some of the work that I've done was trying to make these new recommendations for general internists of small things that they can implement in their clinical practice when they're caring for patients. And small things like instead of using an intravenous antibiotic, if it's been demonstrated for the condition that you're treating that the oral antibiotic is equivalent, well, that's, in some instances, 70 to 80 times less carbon intensive to have the antibiotic by mouth orally than intravenously. So if it's equivalent in terms of patient care, then making the switch to an oral antibiotic is recommended. So there's really, and reducing unnecessary blood tests. We have tons of evidence in the hospital setting that we order too many blood tests, and then often, doing daily blood work on our patients is not actually changing our care decisions. And so reducing that, sometimes to every other day, is a really easy, low-hanging fruit way of reducing resource utilization and carbon footprint in the hospital.
So I mentioned you will be speaking at St. Luke's Climate and Health Series tomorrow, their lecture series. What are you hoping that folks take away from your talk tomorrow?
So really what I hope, and I'm going to be speaking to a group of clinicians, is really that there are very small things that we can do that don't take a lot of effort, that improves the care for our patients and also improves our carbon footprint in healthcare. And in Canada, 5% of our national carbon footprint is from healthcare. So every small thing that we can do can really reduce that huge carbon footprint that healthcare has. So just kind of
Well, I want to
small
thank
things that people can do in their daily practice.
Well, I want to thank you so much for taking time with us. We've been speaking with Dr. Mathilde Goodrow-Simard. She is the director of POCUS for the Department of Medicine at the Ottawa Hospital. She will be speaking about climate conscious decisions in medicine tomorrow at the lecture series on climate and health put on by St. Luke's and Idaho Clinicians for Climate and Health. And thanks so much for listening to Idaho Matters from Boise State Public Radio. Do you have thoughts about today's episode? Make sure you email us at idahomatters@boisestate.edu or reach out on our socials. And if you haven't yet, could I ask you to leave us a review wherever you listen? We read every single one, and we'd love to hear from you. Hi, Idaho Matters podcast listeners. If you're on your smartphone right now, or if you have it nearby, I wanted to pop in to tell you about something to check out. Boise State Public Radio is now on Nextdoor. Here's what that means. Trusted local news, thoughtful reporting, and stories from across Idaho right along your neighborhood updates. If you already have the Nextdoor app, you're halfway there. Just search Boise State Public Radio and hit follow.